Good afternoon, and thank you again for joining us for this update on COVID-19 and Duval County. On the call, we have Director Bruno with Jacksonville Sheriffs Office and Fire Chief Powers with us that will be available for questions when we get to the question and answer. Governor DeSantis was in this morning. The sheriff and I met him at Lot J. We appreciate him being here to see the work that people are doing down there. Look, the governor and his office have been incredibly supportive, both with things we've asked for and what the hospital leaders are asking for. So it was good to be directly with him today, and we appreciate his leadership. Tomorrow will mark the 2-week mark since we had our first positive COVID-19 case diagnosed here in Duval County, and it'll be 2 weeks since my declaration of emergency took effect. A lot has happened in that 2-week time period. We now have 74 positive cases in Jacksonville, and we know that number will continue to increase as we continue to test. I've issued 3 executive orders that limited capacity at businesses, that closed the beaches, and that mandated that employees who can perform their job duties from home be able to do so. Look, I want to address the beach issue for a minute because I know people are frustrated and they want to be out in the sun, in the heat, on the ocean. And I've talked to the beaches mayors about this before we made the decision and since. What we saw when the beaches were open, when we were telling people to social distance, was they just weren't social distancing. So we can't risk the spread of this virus when we've seen people show up on the beach and congregate. And then there's even an issue if they do try to social distance, when the tides come in, it's nearly impossible. So we don't make these decisions lightly. We make them with the public health in mind. And I'll talk here shortly about the other order, which was performing your job duties from home. The governor has issued executive orders of his own, including the closing of dine-in operations at restaurants, the closing of nightclubs and bars, and a really important one here, suspending visitation in nursing homes and assisted living facilities. Again, not easy decisions to make. Incredibly difficult times right now on working people, on the service industry, on small businesses, and tough decisions made in the interest of the public health and the health of our people, the people of Jacksonville. I want to go back to, again, and mention Governor DeSantis' order to suspend visitation in nursing homes and assisted living facilities. I know this is another tough one. People want to be and see their loved ones, but these are some of the most vulnerable people. And the executive order that the governor issued there is a really important one in the fight against the spread of COVID-19, in the fight to keep our people alive, in the fight to keep our hospitals operating under manageable conditions. The actions that we're taking by local government and by the state and federal levels are aimed at flattening the curve. As I said yesterday, this virus doesn't spread. This virus doesn't spread. We spread the virus. That's why we're going to continue to push social distancing and the personal prevention methods. Look, you've heard us say this, you heard me say this a number of times, and other leaders say this. It sounds like simple stuff, but this is what works. Washing your hands, using hand sanitizer, social distancing, not touching your face, your eyes, your nose, your mouth. If we practice these things, we will stop the spread. So please take these things that seem so obvious and so simple, please take them seriously because they work. In the last 48 hours, my office has received dozens of complaints from employees and concerned citizens about businesses that are not allowing employees that can work from home to work from home. I want to again urge businesses, if your employees can work from home, if their job duties can be performed home, let them do it. Look, there are other counties that have gone to a shelter in place, and I'll get to shelter in place in a minute. Those that get to shelter in place, certain businesses just shut down. So I'm asking our local businesses, if you have employees that can work from home, allow them to work from home. And if they can't work from home, make sure you're practicing social distancing and doing the things they should be doing. Code enforcement will soon be in contact with some of the businesses that we've received complaints on that looks like we should be in contact. In code enforcement, phase one will be understanding what's happening and try to work with the employer to make sure that these folks, if they should be, can work from home. And I recognize that all the complaints by employees do not necessarily mean non-compliance, because I've seen a number of examples of complaints. Look, if you manufacture things in a plant, you can't do that job at home. So if you don't call our office and complain, if your job requires in-office or in warehouse operations, just practice the efforts that we've talked about to keep you safe. We have had some businesses reach out to us that got ahead of this and are following it. And I just want to name a few and there's many more than this, but a few that we got some names on yesterday that are allowing their employees to work from home. The HCI Group, Freedom Boat Club, Florida Blue, Gunster Law Firm, One Call. There's so many more. And in fact, I believe a vast majority of businesses are doing the right thing and doing what we're asking them to do. This brings me back to employer and employee. Please get together and figure this out. Government doesn't want to come in and tell you what to do and how to do it. The executive order was to send the message that we want people in their homes working if they can be. Shelter in place. I'm getting asked questions about shelter in place. The things that we're doing in Jacksonville are the things with the information I have and what I've seen happen in other counties and around the country. We're doing the things that I believe are going to make us safe and stop us from spreading the disease. Where you've had shelter in places happen in other places, you've seen a variety of behaviors that work against the goal. Many New Yorkers got on airplanes and came to Florida. We've heard other examples around the country where people leave their county or leave their city and they go somewhere else. You've seen examples this weekend in California where they say the beaches were more crowded than they'd ever been. You're hearing stories about block parties. All these things are against the purpose of what a shelter in place is meant to do, and you can't enforce it. We're hearing stories where this has happened where people are saying, oh, you know, I didn't know all these neighbors on my street. I'm finally getting to know them. Well, guess what? Now people are interacting with people they don't usually interact with at a time when we have a virus that is deadly to some people. If you look at what we're doing, we're asking people that can work from home to work from home. They're home working. People that can't work from home are in their place of employment around people they're usually around every day. So it's not a new population of people, and they should be practicing all of the social distancing and all of the hygiene efforts that we've talked about. So the decisions that we've made here are the decisions that I believe give this community the best way forward to stop the spread of COVID-19. I mentioned that we're working on ideas for relief for small businesses. By the way, relief for small businesses also has an impact on wage earners, on working people. So by next week, I expect that I'll be able to announce an idea to you, which will include city support relief for small businesses. Obviously, that is an idea that once we have fleshed it out, we will work with our members of City Council. We will need their input and their support to make sure that we can, in fact, get relief to small businesses. These are trying and stressful times for many in our community, so I want to take a moment to share some resources that are available to those in need. Our partners at the United Way, through their 211 call center, are able to connect individuals with financial assistance, mental health services, and other resources. Again, financial assistance, mental health services, and other resources. I've talked in the previous days about mental health, about how our lives have been disrupted. Right here, a Real Way, United Way, and their partners can help folks that need that support right now. Many nonprofits are continuing to provide critical services with modifications to meet COVID-19 safety precautions. One example is the Salvation Army continuing their food pantry and meal ministry program. For those looking to support these efforts, I urge you to donate to the First Coast Relief Fund. It was reactivated last week to assist organizations on the front lines, helping those in our area affected by this public health crisis. Donations can be made on the United Way's website at unitedwaynefl.org, unitedwaynefl.org. All over our city, we're seeing people helping one another in many situations and looking out for those in need. While I want to encourage you to be there for one another, I touched on this when we talked about shelter and home. Remind our neighbors that we need to be social distancing. We don't need to be interacting in new groups and new populations that aren't a part of our day-to-day. I want to remind faith-based groups, nonprofit organizations to adhere to the guidance we've been sharing the last few weeks. Do not host gathering events of any kind, and no events should be held for distribution of food and other household staples that do not follow social distancing and safety guidelines we've been talking about for weeks now. The threat to our at-risk citizens is just too great. For those who want to help, consider donating to the First Coast Relief Fund or directly to organizations that are helping those in need. As we approach the end of the month, I want to reiterate my call to landlords to please be lenient on folks during these trying times. We are going to come out of this. We are going to come out of this. So to the extent that we can, let's provide financial relief to people so we can come out of this working to get our way back to people being able to earn a living and take care of their families and small businesses function. Many citizens are out of work with reduced pay and have trouble meeting their obligations. So again, I just encourage everyone to treat each other with compassion and empathy. Before I open it to questions, I just want to remind everyone what I've stated the last couple of days, both in these briefings. And I would ask, if you have room in your coverage in the evenings, both TV, print, and radio, to encourage people at 7 o'clock tonight, call somebody and listen to them and share with them and talk about something other than COVID-19. I'm hearing so many stories about people that are connecting with people they haven't in so long. And I did a number of these last night. One included sending a video chat to somebody, and the other were a few phone calls. For those of you that are praying people, I would ask you to pray for our city and pray for our citizens as we all do the hard work that we have to do, the actionable work to get through the COVID-19 crisis. We're all in this together. I do want to share a moment again that I had this morning that represents social distancing and caring for each other. My daughter Bridget turned 11 today. As you can imagine, when she learned a couple of weeks ago that we likely would not be able to have a birthday party with all of her friends, that was pretty disappointing for a child. I should say a young lady now at 11. And when she woke up this morning and looked out of her window, friends and neighbors had in big chalk in the road written her a happy birthday message. So that is real caring and support in a very responsible way. So with that, we'll take questions. Jim Pickett.
Hey, Mayor. Thank you, Mayor. Just have a question regarding the testing sites. I got an email this morning from somebody saying they're concerned. They were one of the first 50 people to be tested here at the stadium, but having trouble and trying to where to turn for results. Can you help them with that? Is there anything new, like where these people should go?
Yeah, I believe there's an app now, but that they can even go to check, but I'm going to turn it over to our fire chief. Powers?
Jim, they can go to www.labcorp.com/results. When they get in that site, they'll need to provide the following information: their first name and last name, their gender, their date of birth, their address, which includes their street, city, state, and zip code, phone number, email address, and social security number. And they need to understand that there's about a 5 to 8 day turnaround on these tests right now. Very shortly, the city social media sites are going to be pushing all this information that I just talked about out on their platforms.
Christopher Hong, Florida Times Union.
Hey, Mayor, has the city determined how low the number of available ICU beds would have to get to trigger the opening of the field hospital? And can you just give us an update on the status of the field hospital right now and if it's been built yet?
Yeah, I'll turn it. Let me give you a quick answer and then turn it over to Chief Powers. If you look across all systems, I believe right now we're between 65 and 70%. Chief, I'll let you say if I've got those numbers right in terms of capacity. That's and I'm told by experts that that's I don't want to say a comfortable place to be, but it's not a time for any concern. It's kind of normal. It's pretty normal operations. With that, I'll turn Chief Powers over to Chief Powers to answer the remainder of the question.
Chris, the first part of your question about how we determine when to establish that hospital, we'll be doing that with the mayor's office and with our state partners. They'll work together with the data and make that determination as we get closer. Currently, we're in about have a empty bed capacity of about 35% with adult ICU beds, and that's anywhere in the number range from 100 to 150 ICU beds are available, and those are adult ICU beds.
Okay.
Jeannie Blaylock, First Coast News.
Good afternoon, Mayor. Thanks so much for taking my question. You mentioned 74 positive tests so far. Can you give us an update on how many tests have been done total, how many people have been hospitalized? And then from the experts that I know you're consulting with, what do you see in those numbers? How are we doing?
I'm going to pass the specific numbers on testing off to Chief Powers in a moment, but you know, the questions that I'm asking every day are questions about patient load or patient spike, if you will, of known COVID-19 cases. And I'm not hearing anything that is alarming at this point, and I hope that we don't get there. Chief Powers, if you could answer on how many tests have been administered, and if you know if there's been a result of how many have been hospitalized. And let me say this, just because you test positive for COVID-19 does not mean you'll need to be hospitalized. In fact, a vast majority will not need to be hospitalized. The risk is spreading it. Chief Powers, if you'll take the specifics.
Jeannie, I don't know the exact total number that we've tested in the city between the two sites. I'll get that for you. I know today we've tested 162 as of 2 o'clock at Lot J. We've been averaging about 250 day, right at the 250 mark every day at Lot J at the federal site. But I'll get you the numbers, total numbers for you and send them to you shortly.
Mike Mendenhall, the Daily Jacksonville Record.
Yes, hi, Mayor. Can you tell me just the updated number of complaints the city has received on the executive order, and has the city determined how many of those are legitimate claims? And then also with your package that you're talking about with aid for small businesses, will that include direct payments from the city?
Listening to the second part of the question, I'm trying to remember what the first part was. It was, complaints. Yeah, there's been over 50 complaints. People are going through those right now to determine which of those we should have code enforcement to engage at that point. My expectation is that engagement is, look, we care about businesses. We want businesses to be able to operate in this city. So first piece of engagement will be to understand what's the environment there, what's exactly happening, and to try to make sure they end up in a place, if their employees can work from home, that they will be able to do so. The second part of your question will part of the relief be direct support from the city. The concept that we have at this point, I believe that that's a very high possibility. Lorena Inclin, Action News.
Hi, Mayor. Thank you, Mayor. With so many people having trouble filing for unemployment, we've been speaking with a lot of people who just can't get through on the website. what about individual assistance at the city level? Could you speak directly to those citizens who are having trouble even putting their claim in? Are there any city resources for them?
I'm going to have to get back. We will get you more specifics on that. I don't want to, about to answer your question, but I don't want to put it on television and print before I know I'm accurate. So
Okay.
we'll get that to you before deadlines this afternoon. Jim Piggott, WJXT.
You know, Mayor, I'm sitting here in Lot J right now and have been for most of the day. No, the line, like, it's amazing. There's really nobody in line to be tested here, and it's surprising. But I'm wondering if you'd heard anything on that, kind of a follow-up to Jeannie's question. And also, what now about those that don't have a car and the homeless? What are we doing for testing for them if they're symptomatic?
Jim, right now we're working with the guidelines that we have, the tests that we have. Look, we have a few options to test. One is the federal testing site, which the guidelines are, you got to come in the vehicle, you got to follow, the criteria. There's also the Department of Health. And so we're hearing those questions and concerns that you're asking, started hearing them up here today, and are talking about what's the best way forward. What are the solutions to those groups that you just talked about, the homeless and those without vehicle access. Last question, Lorena, Action News.
Mayor, you mentioned that you want the landlords here in Jacksonville to be understanding, flexible with rent and evictions and things like that. But people are really worried that their landlords are not going to be understanding. Would the city step in a situation where landlords are still trying to evict people, collect rent, and we're still in this situation?
We have explored and are exploring how local government could be helpful in these types of situations. I just don't have an answer on that yet. But I would ask, look, if and it's easy for me to say I'm not a landlord, but if you're a landlord and you start, and let me back up. If you're a landlord and you can just give a little bit of space, we may come out of this in 2 weeks or 3 weeks or 4 weeks. That's a month. It gives those tenants, both commercial and residential, some time to get their legs back under them and start paying again. So it could even be good for business, because if you just evict a bunch of people right now, they're never going to get back on their feet. And then who's going to fill the commercial space? Who's going to fill the residential space then if the local economy's collapsed without helping people get their legs back under them? So again, I understand these are private business owners that are making business decisions, but I would just ask if they could just give a little bit of time and let us get through this and just be compassionate.